Hey, it's Scott. And I'm here in Miami with Wendy, who is an epidemiologist from the Florida Poison Control Centers. And what we wanted to touch on in this week's Give Me Five is just a couple facts and, more importantly, fallacies when it comes to fentanyl. And with that in mind, from the medical perspective, remember, fentanyl is fabulous. We give it all the time for pain relief, for surgery, for sedation. It is an absolutely great drug. So with that in mind, from a medical perspective with medical fentanyl, this is not a problem, right? You take your syringe, you draw it up, you push it in the patient. This is not a problem. You do not need to wear gloves. We don't wear gloves when we draw up medications unless it's chemo out of the bottle, in this case of fake fentanyl. It's not an issue. Now, taking that one step further, though, in the last couple of years, people have become really freaky about fentanyl. And there's a couple issues out there. Number one, people are convinced, Wendy, if I may, that if I take the fentanyl and I drop it onto her hand, within seconds, she's going to completely be unconscious and or in respiratory arrest. It is not the case. Other issues, if you would.
Yeah, so, in the drug prevention world, we've been trying to get the word out about illicit fentanyl and letting people know that there's fentanyl in the drug supply and what the problems are with that. And so there have been billboards in our community that say, like fentanyl kills and things like that. And I think for the public that can confuse the issue of the medical grade fentanyl that is being used by people who know what they're doing, and it's very controlled, the dosage is controlled, the purity is controlled, versus what's happening in the illicit drug market, where we're seeing these really potent counterfeits and basically very little quality control. So even a half a pill we see in some cases can be very seriously dangerous. So I think that's confusing people, and we are seeing people who are then expressing concern even in a medical setting where they're afraid to use fentanyl. So we don't want that. So in the public, we're out there trying to let people know about the routes of exposure that are really more likely to cause a problem. And so that would be consuming counterfeit pills. Locally in our community, we do see also fentanyl combined with cocaine, which is unusual, right? Because you got a stimulant and a central nervous system depressant together. It's kind of a strange combination. But we've also seen fentanyl in alprazolam, sort of counterfeit Xanax, and some of these other settings. And this can affect not just people who are, very familiar with the drug market, who have tolerance, but this can also impact our young adults who are, trying a pill at a party, or they are told that they can study better with, a counterfeit Adderall. These are some of the other settings we're seeing really, really scary outcomes, including fatalities.
So you were bringing up, when we were talking earlier this morning, about there's a big difference between medical fentanyl, where we draw it up out of a bottle that we know is medical fentanyl, versus if you are a police officer and you literally walk into somewhere where they are making fentanyl. That's, as you can imagine, a completely different story. Very appropriate. You've got fentanyl flying all over the room. You know what? That's a completely different ball of wax. And for most of us in healthcare, happily, that's not what we encounter every day.
Yeah.
But with that, what was kind of interesting when we were chatting was the fear of both healthcare, law enforcement, et cetera, in regards to being exposed to fentanyl and people dropping dead.
Yeah.
And you brought up a totally really neat idea that the only fatality that's currently reported in regards to fentanyl was...
Well, the only in terms of where we had an officer die that we're aware of or we've seen published was in fact a canine officer, which makes sense, right? So, certainly a dog on scene, if there's going to be powder, that that they're sniffing it up, right? They're insufflating it, and so that is a route of exposure that absolutely can present a risk of fatality. But typically, when officers come on the scene, they're not going to be ingesting it, they're not going to be inhaling it under except very unusual circumstances. And so we really don't worry too much about officers, being impacted by fentanyl when they come into a setting where it might be present, or specifically responding to someone who maybe swallowed a pill. And we've seen some confusion about, that there might be risk to a responder from just even rendering aid. And we don't want that to slow people down from giving aid as needed.
So kind of put it simply all together, if somebody meeting your patient snorted fentanyl, smoked fentanyl, injected fentanyl, swallowed fentanyl,
Right.
you are just fine.
Yeah.
You can take care of them. You can give them Narcan or naloxone just like any other opiate. But just touching them is not going to make you go into respiratory arrest. Breathing the same air that they are is not going to make you go into respiratory arrest.
Right.
And again, dripping fluids onto them.
I'm the guinea pig here.
Right? It will utterly be gross, but it's not going to make you go into respiratory arrest. So with that, that simply is our quick review of the facts and fallacies when it comes to fentanyl.